Hello, this is the pain, sleep, and rest lesson for your assessment course. Please remember to participate in any assignments that pop up from Edpuzzle or PlayPosit and any other assignments that I may instruct you to perform. Lesson objectives should be used to guide you in your reading and other assignments. You will identify commonly occurring alterations in comfort and related therapies, differentiate common assessment procedures used to examine comfort across the lifespan, which we'll probably implement that in class, demonstrate assessment of comfort during physical examination and documentation of assessment, and demonstrate the nursing process in providing culturally competent and caring interventions across the lifespan for individuals with common alterations in comfort. We're going to start by talking about what comfort means. Your Pearson book defines comfort as the immediate state of being strengthened by having the needs of relief, ease, and transcendence addressed in the four contexts of holistic human experience: physical, psychological, spiritual, sociocultural, and environmental. So you can see that it's more than just the physical pain that we as nurses need to consider. So comfort is thought of as all of these components at meeting the individual's needs so that the person can experience full comfort. And we know research has shown that increased comfort can result in a shorter hospital stay and better healing. So that's important to keep in mind. From a nursing standpoint, we consider comfort the absence of pain, whether or not the patient is well rested, which in a hospital setting can be difficult. Are they nutritionally balanced? So are they able to eat? Have they been eating the proper foods? So when somebody is not able to eat, we have to take into consideration how long they can go before we need to intervene. Minimal stress in the environment. The hospital certainly is a stressful environment, so we want to minimize the stress by reducing noise, the number of times we enter the room during the night, and so forth. Also, sensory perceptions: heat, cold, noise. Hospitals tend to be on the colder side, so we want to make sure that our patients are warm enough, that the temperature is controlled. And again, all of this ties into their healing process. Comfort can be thought of as one of the basic physiological needs. So when somebody feels comfortable, they can move up the chain of Maslow's hierarchy of needs to actually self-actualization. So physiological needs include comfort and need to be met by our patients who are either hospitalized, under our service in home care, long-term care, acute care, whatever the setting. It's important that we meet those needs of comfort so that the person can heal and move on with their lives. Nurses automatically think of comfort as being pain-free. We talked in the previous slides about the fact that comfort encompasses a lot more, but now we're going to focus on pain. It's defined by your Pearson book as the unpleasant sensory and emotional experience related to actual or potential tissue damage. So we certainly have to rely on the person telling us that he or she is experiencing pain for the final determination. And that's where we get into the pain scales. If you have been a patient yourself, or some of you work in the healthcare field, you may have come across the pain assessment tools. One is a scale where we ask a patient to rate their pain from a 0 to 10, 0 being no pain, 10 being the worst pain ever. And then we can get an idea of what they're experiencing. Sometimes we'll also include what number is acceptable to them. At what number can you still function? And that's going to vary per individual. So subjective is the best assessment tool for pain if we can get the person to tell us and acknowledge it. Objective indicators can also be used. Somebody who's nonverbal or unable to let us know that they're in pain, for example, a young child, or maybe there's a language barrier. We can look for facial grimacing, restlessness, crying, guarding, where they're holding that area of their body, and elevated blood pressure when the sympathetic nervous system comes into play. So those certainly are all indicators. But just remember that subjective is going to be the best tool for determining pain. And we certainly want to get that data if we're able to. In order for us to get a subjective assessment of pain, the person has to be able to feel the pain. And that is defined as nociception. That's the conscious awareness that occurs when an individual perceives pain. So it's pain perception. There are some individuals who cannot feel pain. Somebody who is paralyzed, for example, may not have that ability to feel pain. And we get concerned about that. Somebody who's had a stroke or is paralyzed for other reasons. We get concerned about injuries because that is a defense mechanism. When we're injured and we feel pain, we know to pull our extremity away from whatever is causing the pain, whether it's a burn or just so that we can pay attention to that area. When somebody does not have nociception, they're not aware that something has occurred, that there is pain. So that's something that we have to take into consideration. The individual may not be able to feel the pain, but it doesn't mean that there's not an injury or something that needs to be addressed. So nociception, the ability to perceive that pain is there. And it's important. You're going to have to know that. So again, the best pain assessment is subjective. That's always going to trump anything else. But other manifestations of pain objectively would be the fight or flight response from the sympathetic nervous system. And I'm going to put a Edpuzzle or PlayPosit activity here where I want you to consider what responses occur from the sympathetic nervous system when it's stimulated. Okay. Other objective manifestations would be crying, grimacing, shielding or guarding, posturing, somebody moving a little bit slower. So again, not everybody is going to tell you that they're in pain, and these are some things that we can look for. You can look at the pictures down here. This one is an example of somebody guarding or shielding. This person is posturing and certainly holding the area that is presumably hurting, his lower back. Here's a little one who probably cannot subjectively let somebody know about the pain, so he's holding his belly, and here's a child who's crying. We have to consider developmental stages and cultural circumstances, which we will get into. It's important for nurses to understand different types of pain as well, because we're going to address them differently. Somebody who has acute pain, it's usually sudden, identifiable, minutes to months. An example would be somebody with appendicitis. Could be sudden, they're holding their right side, verbalizing that there's pain, maybe describing that it's a stabbing pain or a dull pain. And again, it can last minutes to months, but there is an expectation that whatever the pain is going to heal in less than 6 months. Okay, so acute pain is usually sudden and can last up to 6 months. But you would expect that pain to heal when whatever's causing the pain is removed. Chronic pain is something that we define as beyond the expected healing time, so greater than 6 months. So an example of chronic pain would be arthritis. That's something that somebody's going to live with on and off, maybe constantly, and probably for the rest of their lives. And I say that we're going to treat things differently because somebody with acute pain, we would not expect to necessarily deal with the psychological component in most cases. Somebody that has to live with chronic pain, we would need to intervene and help them to learn to deal with living with that pain for the rest of their lives, which can be very difficult. Other types of pain: central nervous system pain, which would be damaging to the nerves, and that's very, very painful. Phantom pain is very real. It's felt in an amputated part of the body. And that's just because the brain has not yet acknowledged that that part is not there anymore. There are therapies that can be done to deal with that. Until the therapeutic effects of the psychological component have come into play, we do give pain medication. So it's not acceptable for anyone to say, well, there's nothing there, you can't possibly have pain. We still treat it as though that limb is there, and then do therapy where you have them look at the area, massage the area so that the brain can adjust to the fact that it's not there anymore. And it's a process. And then there's psychogenic pain, which again is very real. There's absence of physical factors, but the pain is real. Um, the pain would be relieved with pain medications and psychotherapy as well. So those are the different types of pain that you should be aware of. So I'm going to have you do a Padlet mandatory assignment. So what this is, it's just basically a website if you haven't used Padlet before, and it will come up just like a notepad, as though you're writing notes on a notepad, and you're all going to do this together, but individually. So what you're going to do is go to the website, which I'm going to show you in a minute that I have listed here. If it prompts you to put in a password, it's just all caps blended one. And then you click anywhere on the box, click anywhere on that pad that you see, and a box will pop up. Write your first and last name so you get credit for doing it. And I want you to give one example of acute pain and one example of chronic pain. And don't duplicate what someone else has already written. Once you enter what you're going to write and you hit submit, you won't be able to change it. So make sure that before you hit submit, it's exactly what you want. And you won't be able to change anybody else's either. So what you're going to do again is just go to Padlet.com that I have written right there. And let me move this over so you can see. Types of acute and chronic pain. You can see I already did one. I have my name here, acute pain an example, and chronic pain an example. So you're just going to click anywhere you want. I guess it's a double click. And then your title, just put your name and then you write something there and then it will record. Okay, so at the end of this, we will have a full page of all kinds of examples of acute and chronic pain, which I will then make sure that each of you has. So just to reiterate, go to this link. If it prompts you to put in a password, it's blended one. Click anywhere and a box will pop up. Write your name, your full name so you get credit, and give one example of acute pain, one example of chronic pain. Don't duplicate what somebody else has written because there are many, many, many examples. And then we'll have a full page of examples. When we're assessing people of different cultures for pain, really anything, but since this talk is on pain, you have to think about who you're talking to and the fact that they may not convey the fact that they're having pain or discomfort of any kind. So we use the LEARN model of cross-cultural communication. I will tell you that that is not in your book, and I did put the source down at the bottom here if you'd like to look into it further. It is on the older side, but I do like this mnemonic. So what you need to do more so than just going in and saying, do you have pain? You have to listen and empathize with the individual. Okay, put yourself, empathizing means you're trying to put yourself in the other person's position. So if somebody just had, for example, an appendectomy, and you go in the room and ask if they have pain and they say that they don't, you have to put yourself in their position. Would it be expected that there would be pain? They may very well not have pain, but you don't just stop at asking the question. So you want to put yourself in their position. Explain your perception. So, I'm concerned that you do have pain because you just had an appendectomy. The pain medication you had in the operating room and post-op would have worn off by now. So I'm concerned that you are experiencing pain. And then explain why you're concerned and how it's going to limit them with their ability to heal. Acknowledge their point of view if they share. Discuss similarities and differences in your culture versus theirs. Recommend treatment, and that means ordered treatment because we're nurses, we're not doctors, we're not prescribing, but recommend that they take the pain medication as directed. Even outside of a cultural communication issue, it could be somebody that is concerned about becoming addicted, and then it's our job to explain the difference between addiction and dependence, or tolerance, I should say. So we would want to explain that, and then negotiate treatment. Okay, maybe they're not willing to take pain medication, but maybe there's something else that has been ordered for comfort. So we want to do more than just ask somebody of a different culture, or anybody, whether or not they're having pain. You have to look for other signs and consider whether or not it's reasonable that they would be denying having the pain. This video is an example that some other nursing students had done, not from HACC, but from somewhere else, and I thought they did a good job, so I'm going to use it. That just gives you an idea of what we're talking about with that learn theory, or mnemonic, I should say, and the fact that you do have to go a little bit above and beyond just asking the question of, are you having pain? So I'm going to pull this up.
Culture influences beliefs about how to prevent and treat illness and what constitutes good care. More specifically, it influences how each person experiences and responds to pain. By virtue of belonging to multiple cultural groups, each of us has a unique cultural perspective. Nurses must embrace this crucial point in order to provide patients with culturally acceptable pain management. In this scenario, there's language and interpretation problems. Successful pain management and education is contingent upon effective communication. Language interpretation problems can be a barrier to effective pain management. Nurses can prevent patients from different cultures who speak different languages from suffering pain with effective communication. In this scenario, the nurse Jennifer is taking care of a Spanish-speaking only patient who does not speak English and is one day post-op knee replacement. The nurse's lack of cultural sensitivity is a barrier to effective pain assessment.
Good morning, Miss Maldonado. My name is Jennifer. I'm going to be your nurse today.
No,
Are you having any pain?
Tengo mucho dolor.
No, pain. Are you having any pain?
Me duele
Any
mucho.
pain? Like, ow?
The nurse should have secured an interpreter for the patient who is not proficient in English and ask her about cultural therapies that might have been helpful.
Oh, I see here that Mrs. Maldonado is a Spanish-speaking only patient. You know what? I'm going to get an interpreter for her. Hi, this is Jennifer on 6 Northeast. I'm going to need a Spanish-speaking interpreter for my patient, Mrs. Maldonado. Great, thanks! So I have a patient here. Her name is Mrs. Maldonado, and she's Spanish-speaking only.
Okay.
I'd like to ask her about her pain.
Okay.
You ready to go into the room?
Yeah.
Let's go. Hi, Mrs. Maldonado. I brought an interpreter here for us, okay?
Me llamo Vera, soy la intérprete.
Are you having any pain, Mrs. Maldonado?
Su enfermera quiere saber si tiene dolor.
Sí, tengo mucho dolor.
She's saying she's having a lot of pain.
Where is your pain?
Miss Maldonado, ¿dónde tiene dolor?
Tengo el dolor en la rodilla.
She's saying it's on her left leg where they did the surgery.
Can you describe the pain for me, Mrs. Maldonado?
¿Me puede describir cómo es el dolor que siente, Miss Maldonado?
Sí, es fuerte el dolor, mucho, fuerte.
She's saying it's a sharp throbbing pain on that leg.
Okay. You know what? I have a chart here that I would like to ask her where her pain is on a scale of 0 to 10, and it's in Spanish.
Okay. Miss Maldonado, del número 0 a 10, ¿me puede decir su nivel de dolor?
8, el 8.
She's saying her pain is an 8.
Okay, all right. I'm going to get you some pain medication, Miss Maldonado, okay? And I'll come right back in a half hour to make sure that the pain medicine works, okay?
Su enfermera le va a traer medicina para su dolor. Después que la enfermera le dé la medicina, regresa en 30 minutos para ver si tienes menos dolor, ¿ok, Miss Maldonado?
Okay. Muchas gracias. Muchas gracias.
Effective communication with patients whose language differs from your own are the use of interpreters and translation services. People from cultures who value stoicism tend to vocalize with moans and screams when they are in pain. They may strive to keep their faces masked through facial grimacing. They may feel that they'll be perceived as weak if they admit to or show pain, and they may deny having pain when asked. They may often prefer to be left alone to bear their pain without bothering others. In this scenario, the patient is of Asian culture where stoicism is valued. The nurse lacks knowledge of cultural differences of expressing pain.
Good morning, Mrs. Pye. I'm Jennifer. I'm going to be your nurse today. Are you having any pain?
I'm okay.
No?
Yeah.
You sure? All right. See you later.
The nurse should have incorporated the LEARN model, which is a mnemonic for listen, explain, acknowledge, recommend, and negotiate. This model improves communication, which improves pain outcomes, as demonstrated by the next scenario.
Good morning, Mrs. Pye. My name is Jennifer. I'm going to be your nurse today. Are you having any pain?
I'm okay.
You know what, Mrs. Pye? I can see that you're uncomfortable. Can you tell me what you're feeling?
I'm okay.
You know, it's very common for patients who have pancreatitis to experience a lot of pain. And if you are experiencing any pain, I'd really like you to let me know so that we can do something about it. Okay. You know that pain actually will slow the healing process, and it increases your discomfort. And there are many ways that we can help alleviate your pain.
You know what, Jennifer? I actually am in a lot of pain. I think I need pain medication.
On a scale of 0 to 10, what do you think your pain is?
Around an 8 or 9.
You know what? We'll get you some pain medication, okay?
Thank you, Jennifer.
Although the wishes of patients with these beliefs must be respected, nurses still need to provide them with information that will allow them to choose whether or not to accept treatment for their pain.
You know what, Jennifer? Can I have a cup of water?
Sure, no problem.
And can you hold the door behind you?
I got it.
In some cultures, different methods such as acupuncture, meditation, coining, and herbal teas are used for management of pain. Coining is done by Vietnamese folk healer by scraping a coin over a patient's oiled back, which is believed to release bad wind, which is believed to be the cause of the patient's illness. In this scenario, Miss Wynn is a 68-year-old woman with a history of stroke who was brought into the ER by her daughter, experiencing chronic back pain for several months and has been treating the pain with herbal tea, meditation, and coining.
Oh, my back! Jennifer! Jennifer, where's my herbal tea?
Oh, we don't have any of your herbal tea right now, Mom. We're in the
I'm not saying
hospital.
my back is hurting me.
I know, Mom. I
How
know.
about, where's the coining? I'm gonna do coining now. I'm gonna do coining. Where's the coining?
We don't have any coins, Mom. Here,
I
you
need
know what? Sit down. I'm gonna go get the nurse, okay?
Hurry!
Nurse, my mom, she's in a lot of pain right now.
Oh, okay, I'm gonna go right in.
Okay.
Hi, Mrs. Wynn, are you in pain?
What do I look like?
Do you like any pain medication?
No, I like those pain meds. Those give bad energy.
Well, with pain, when you don't manage your pain, it can cause increased discomfort and actually alter your healing process.
But I don't like pain meds. Where's my tea?
Well, I'm glad to hear that your herbal tea is okay to take with your medication.
Okay.
So it was checked with the pharmacist by your doctor.
Okay.
Well, your daughter Jennifer, she mentioned that you use coining as.
Oh yeah, every day.
Well, you're on Coumadin and it's a blood thinner, and with
What?
the use of coining, it increases the risk of bleeding.
What? You didn't tell me this. I don't wanna bleed.
Yeah, so while you're on this medication, you shouldn't do coining.
Oh my God.
And Mrs. Lin, I read in your chart that you do meditation.
Oh yeah, I do meditate. I go.
Okay,
You know.
that's actually really good because it's evidence-based practice of
Oh.
effective pain management.
Well, where's my tea? I still want my tea.
Well, I guess, your pain medication, it actually comes in liquid form too. Here's your tea, Mrs. Lin, with
Okay,
your
thank you.
medication.
Thank you.
All patients have a right to effective pain management. Understanding the influences culture has on patients' pain experiences and attitudes regarding treatments will permit nurses to achieve better pain outcomes for all of them.
So that gives you an idea of what we're talking about with culture and different beliefs and communicating with people of different cultures and ethnic groups. So I know sometimes that video got a little goofy, but I do appreciate what they were trying to convey, and I think it gives you a good idea of what we're talking about with cultural considerations. Lifespan considerations are important as well for pain assessment, and this is in your book. So I'm going to want you to use your book and complete an assignment where you need to think about, when you're assessing these individual age groups, what do you have to take into consideration for an infant, for a child, an adolescent, an adult, and an older adult. For the rest and sleep and rest portion of the talk, you need to first understand how much sleep each individual age group needs. So newborns need about 16 to 18 hours a day, infants 14 to 15 hours, toddlers 12 to 14, preschoolers 11 to 13, school age 10 to 11, adolescents 9 to 10, adults need 7 to 9, and older adults need 7 to 9 hours. So you can see the older we get, the less number of hours we need, but that does not mean that we're getting the quality that we need. So we have to take that into consideration. It's not just the quantity, but the quality of sleep. Factors that affect our sleep: emotional stress, which certainly in nursing school you can understand that. Stimulants and alcohol. Even though alcohol is a depressant, it does interfere with our sleep cycle. Poor diet can impact the quality of sleep. Smoking, motivation, and that means how motivated are you to get sleep. If you're so busy, you're up really late studying or cleaning, you may not have motivation to get the sleep that you need. So that has to be taken into consideration. And also medications, hypnotics, beta blockers, narcotics. There are many different medications that can interfere with effective sleep patterns. So how do we assess sleep? There is a sleep questionnaire to determine if sleep is a problem, which I can pull up, I hope. Yeah, there it is. This is online. And it just asks general questions. Can't get to sleep within 30 minutes, wake up in the middle of the night. So they're trying to determine, is this somebody who is having trouble falling asleep, somebody who has trouble staying asleep? Because there are different reasons that people can have their sleep impacted. So you can look at this at your leisure. It has to do with comfort, medications, and then it comes up with a score. And that helps the practitioner to determine how they can best intervene. Objective assessment for sleep is a little bit different. The nurse is not going to watch somebody sleep, and because there's no way to determine how somebody is whether or not they're getting quality of sleep just by looking at them. Sleep studies are done, but it's not just by observing the person. It has to do with the oxygenation. So as a nurse, assessing somebody as they're sleeping is not effective. Rather, you want to assess how alert the person is during sedentary activities. So, for example, if you're working in long-term care and you're assessing an elderly person when they're at mealtime, when they're supposed to be eating and they're sitting there sleeping, that can mean that there are problems with medication, that their sleep was interrupted, and so they're certainly fatigued. So you would want to observe how they are behaving during sedentary activities. Are they able to stay awake or are they falling asleep? Oftentimes, I can tell as a nurse in class whether somebody has had effective sleep by how awake they are during lectures. And I can usually pick out which students are working night shift in the classes or are just sleep deprived from studying, from families, and from life in general. So you want to be observing individuals and how alert they are during sedentary activities. And that concludes this lesson on rest, comfort, and sleep. Again, use the objectives to guide you in your reading and other activities. Ask questions when we meet in class, and make sure that you complete all of the activities.